Hi, I'll be reading Morphine. What's morphine? Morphine is an opioid pain medication. An opioid is sometimes called a narcotic. Morphine is used to treat moderate to severe pain. Short-acting formulations are taken as needed for pain. The extended release form of this medicine is for around-the-clock treatment of pain. The form of morphine is not for use on an as-needed basis for pain. Morphine is not for treating short-term pain just after surgery unless you were already taking morphine before the surgery. Morphine history. In the 18th century, Europe had high demand for Chinese goods, such as tea and silk, but the Chinese did not have high demand for European goods, creating a trade deficit. China and Britain had then had a war, which was called the Opium War, and this marked the beginning of during which the British defeated the Chinese and resumed the opium trade. To make sure morphine is safe for you, tell your doctor if you have a history of head injury, brain tumor, seizures, urination problems, or liver or kidney disease. Important information: you should not take morphine if you have severe asthma or breathing problems, a blockage in your stomach or intestines, or a bowel obstruction called paralytic ileus. Morphine can slow or stop your breathing. Never use medicine in large amounts or for longer than prescribed. Who should not take morphine injection? Alcohol. One condition is alcohol intoxication. Another one is chronic obstructive lung disease. Another one, paralysis of the intestines. Allergies are opioids, morphine analogs. Morphine's clinical trials/studies. Between 1805 and 1816, a pharmacist assistant called Friedrich Wilhelm Serturner managed to isolate a yellowish white crystalline compounded from crude opium after immersing it in ammoniated hot water. Morphine side effects: slow heart rate, sighing, weak or shallow breathing, chest pain, fast or pounding heartbeats, infertility, missed menstrual periods. Different names for morphine: TNT, Goodfellow, White Stuff, and Morph or Drone. What other drugs will affect morphine? Narcotic opioid medication can interact with many other drugs and cause dangerous side effects or death. Be sure your doctor knows if you also use other narcotic medications, opioid pain medication, or prescription cough medicine. Drugs that make you sleepy or slower breathing, a sleeping pill, muscle relaxer, sedative, tranquilizer, or antipsychotic medicine. Morphine's contraindications. Morphine can be administered orally, intravenously, rectally, subcutaneously through spinal injection, as well as through inhalation or snorting. Sorry, I can't say it. Morphine may interact with CNS depressants, muscle relaxants, or cimetidine. Morphine dosing information. Usual adult dose or morphine for pain. Morphine sulfate used for pain relief may be injected intramuscularly in doses of 100 and 150 kilograms every 2 hours as required. For operations and anesthesia, the dose of morphine that needs to be administered depends on the duration of surgery and the severity of pain anticipated.